For Action News, I'm Anna Dulosky with your health news update. Bioengineered crops are the wave of the future, with more than 5 billion acres harvested since 1996. The benefits are huge. They provide food for millions. They reduce the use of pesticides and reduce the release of greenhouse gases. And yet, anti-GMO activists continue to promote false and misleading statements, ignoring the fact that we've been modifying genetics of both crops and animals since agriculture began, some 10,000 years ago. Thanks to modern technology, we have the ability to monitor these changes now more than ever. To learn more about engineered crops, we encourage you to read ACTIA's recent publication on ag biotech. You can find it on actia.org. The CDC has some good news to report from its annual vaccination coverage report, which found high levels of vaccination coverage overall. The overall numbers are good, but 26 states, including D.C., reported vaccination rates below 95% for 2 doses of the MMR vaccine. And surprisingly, Mississippi reports the highest percentage of children who are up to date on required shots. Officials say that's because the state's law only allows valid medical reasons to be exempt from vaccines. Finally, we can understand why some people may have a slight concern over Ebola in the U.S., but some communities may be taking it a bit too far. A teacher who had traveled to Texas for a conference was placed on a 3-week paid leave of absence when she returned. Why, you ask? She stayed in a hotel 10 miles away from the Texas hospital where Thomas Duncan died of Ebola. Abundance of caution is an understatement here. If there's one thing we know for sure, it's that you cannot get Ebola without direct contact with someone with physical symptoms. ACTIA's Dr. Josh Bloom has plenty to say on this topic. You can check out his latest article and all the others on our website, actia.org. And while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox. For Action News, I am Anna Dulosky.